Hello everyone, Dr. Callanan here, and in this video we are going to go through blood work from a patient case, and we are going to be discussing all about what we found in the blood work that helped to explain why she was experiencing hair loss in the first place. As a naturopathic and functional medicine doctor, I always aim to get to the root cause of an individual's health concern and educate them on the different treatment options. I am very passionate about informed consent and providing education on here are all the available options to you. When we look at blood work, it's very important to pair the blood work with a detailed patient history so that we have some context. In addition, there are normal ranges, but then there's also optimal ranges. These normal ranges are really broad. So for an individual who is experiencing hair loss, there are a couple key markers that we're going to discuss that is really important that we get these in the optimal range. So this was a particular individual, female patient. She's been experiencing hair loss on and off for a number of years. She does have diffuse all over shedding, so telogen effluvium, but she also does have more of the androgenic picture that we see with male pattern hair loss or female pattern hair loss, where we're starting to see separation of the part or a little bit of loss at the crown or at the side. So she did have both. So we wanted to look at everything. And this is something that we do for patients as well. So the first thing we had to look at is for blood sugar. So our fasting blood sugar, this is the exact moment we did the blood draw, 4.8, this is healthy and normal. This does not tell us anything but what was your blood sugar at the exact moment we did the blood test. The hemoglobin A1C, this tells us the average blood sugar over a 3-month time period. This provides us more information. So if we see she's at 5.5, which does technically put her in the at-risk category for prediabetes. Now you might be thinking, what does prediabetes and blood sugar have to do with hair loss? Well, we do know that insulin resistance and higher levels of blood sugar will throw off your hormones, whether you're male or you're female. Your blood sugar is critically important. If you have insulin resistance as a female, we can see higher levels of free testosterone. We can also sometimes see higher levels of DHEA. This both can cause more of that quote unquote male pattern hair loss on the head. Females who have elevated blood sugar and insulin resistance can also sometimes see irregular cycles. Now, if you have irregular cycles and you're not ovulating, this is a problem because you're not getting the rise in progesterone. Progesterone is really important to go to the brain to calm you before your menstrual cycle. Progesterone at the level of the hair follicle is really important because it blocks the conversion of testosterone to DHT. That's that super testosterone that can cause the hair loss. So as you can see, everything is interconnected, and it's really important that we look at everything as a total to understand what is particular for this individual, what is going to be the most effective for them to help their hair grow back and prevent additional shedding. So yes, we want to have a look at insulin resistance. We want to treat this not only for the hair loss, but also for the prevention of chronic disease. So things like cardiovascular disease, dementia, Alzheimer's, stroke, type 2 diabetes. We can see increased risk of overall mortality in certain types of cancers with higher levels of blood sugar as well. So this is really important. We had a look at her white blood cells, her red blood cells, her hemoglobin. I'm not going to go through every marker like I would on a patient visit, but I'm going to go through the key ones for hair loss. For instance, hemoglobin. This tells us whether or not the patient is anemic. I like to see the hemoglobin at least 135, so this is lower. Lower amounts of hemoglobin or anemia could be coming from a B12 deficiency or an iron deficiency. For this, we need to look at the size and shapes of the red blood cells to understand which one it is. Her MCV is low. You don't need to know the details, but a lower amount of MCV is usually associated with iron deficiency as well. So we need to look further down on the blood work to see where is the ferritin, where is the iron level, to understand what's going on here. Now, when I see a patient with lower levels of iron or iron deficiency, I always ask the question, why? So yes, we can use iron-based supplements to help, but why is it low? Are you having heavier cycles? Are you not consuming iron-rich foods? If you are consuming iron-rich foods, are they not being absorbed and digested? What's going on with the gut microbiome? So this is really where we have to do that detailed patient history. It's not just about looking at the lab work. We really need to understand what's going on for you to develop the appropriate treatment plan. In terms of other things that can cause hair loss, low vitamin D, but her vitamin D was fine. I typically like this to be anywhere from 100 to 150. Now, keep in mind, these are Canadian lab ranges. This may be different if you are looking and comparing lab ranges from a US lab like LabCorp or Quest. Just keep that in mind. B12, I like to see them greater than 500. That's perfect. Then we went on to look at the thyroid. The most important hormone is the free T3. This is what binds to the cell and activates it. Her free T3 is great. Now, what I am seeing is TSH, or the brain signal to the thyroid. I find it's optimal around 2. So this individual is at 2.5. This means that the brain is turning up the dial, turning up the signal to the thyroid to make thyroid hormone. The thyroid is still listening and producing T4 and T3, but it could be optimized here. So in this case, we want to look at what are contributing factors that can make thyroid function not as optimal. Higher amounts of cortisol, low iron, higher amounts of inflammation, not having enough things like selenium and zinc, the building blocks for the thyroid. We also see that insulin resistance is associated with higher amounts of TSH. So again, we need to look at the whole picture and understand, okay, how can we get the body optimal so all of the organ systems can work optimal? Her free testosterone was not too bad. That's great. No concerns there. Ferritin level, this is a marker of the stored form of iron. Now, with ferritin, we have to keep in mind, this can artificially be increased during states of inflammation. So if you have inflammation and your ferritin looks optimal, it may actually not be optimal because the inflammation is driving up the ferritin. So that's something to keep in mind. Regardless if this is driven up by inflammation or not, the optimal ferritin for good hair growth is usually greater than 80 to 100. So we may need to consider looking at, why is this iron so low? In terms of the hormones, I hear a lot of individuals having troubles getting their hormones tested because their primary care, their doctor is saying there's no point in testing hormones, they change throughout the month for females. This is true. Your hormones do change each day of your menstrual cycle. But if we know when you went for the blood work in relation to when your period came next, we can interpret it appropriately. So usually I would anticipate the progesterone being about 10% of the estradiol, 7 to 10 days before the period. Now, this test is not quite 10%, but this individual wrote down that her period came a couple days after doing the test. So that makes sense. We did see a rise in progesterone here, which does tell me this patient is ovulating or ovulated this cycle. Because if we look at the follicular phase, is the first half of the menstrual cycle where you have not ovulated yet. Progesterone's low, it's less than 1.7. Then in the middle of your cycle, more or less, you have ovulation. And after ovulation, you get a rise in progesterone for the second half. So I know this patient has ovulated because we saw a change in the progesterone here, which is perfect. Fasting insulin. Insulin is very important to run on blood work because it can tell us how hard is your body working to control your blood sugar. I'm going to switch over my screen in a second to explain this better. Previously, we looked at the average blood sugar, or the hemoglobin A1C. This tells us what was her blood sugar the 3 months prior to doing the blood work. That was 5.5, being at risk. I want to know, how hard is the body having to work to keep the blood sugar under control? Because maybe her A1C looked good at 5.3, let's say. But if the body's having to produce really high levels of insulin just to keep the blood sugar under control, that's not optimal either. And the reason it's not optimal is because higher amounts of insulin can cause weight gain, skin tags, hair loss in the head, changes to your hormones, impair your thyroid function, create inflammation. And 1 in 2, some studies are saying 1 in 2, some studies are saying 1 in 3, individuals in America are actually suffering from insulin resistance. So we need to test for this, and there are ways that we can treat this. So because I'm so passionate about insulin resistance, because this is such an important topic, we're going to go through some visuals and then we'll jump back to the labs. When you consume carbohydrates, whether they're healthy ones like fruits and vegetables or unhealthy ones like cake and cookies, those carbohydrates are going to be broken down into sugar or glucose. And that's what you can see here with the red squares. Then that goes into your bloodstreams. You eat carbohydrates, they're digested, your sugars go up. Now, the next thing is we need to get those sugars down, because if you have high blood sugar and it remains high, that's type 2 diabetes, and high blood sugar is damaging to your eyes, your kidneys, your nerves, etc. So what happens? Your blood sugar rises, and this tells your pancreas to make insulin to bring the blood sugar down. Insulin is shown here as the key. And the key lowers your blood sugar by opening up the door on the outside of the cell to get the sugar into the cell. As long as sugars get into your cells, you feel good, your muscles work, your brain works, you have energy, you maintain your weight rather easily, and you feel good. Now, in insulin resistance, the lock and key becomes jammed. So now what happens is your body has to produce more and more of the keys. The blood sugar gets higher and higher and stays higher and higher longer, more and more insulin, more and more of those keys. Eventually, you'll get your blood sugar down, right? Her A1C was 5.5, being at risk, but her insulin is much higher than optimal. Higher levels of insulin is a problem because look, this causes changes to the cholesterol. It can raise triglycerides. And unfortunately, we're so hung up and so we need to lower the cholesterol, but we don't even look at the insulin level. Higher levels of insulin can cause higher amounts of free testosterone. So in women, we can see acne, we can see hair growth on the face, hair loss on the head. We can see as well increased amounts of DHEA, and this is where we can see irregular cycles. We can also see resistant weight loss. Now, this is a spectrum, right? Optimal blood sugar management, optimal metabolic control, really bad type 2 diabetes. And there's a spectrum in between. So some women with higher amounts of insulin actually start to develop cysts on their ovaries. They can see irregular cycles, and we call this PCOS. This patient had some of the signs of PCOS, right? She has the hair growth, acne. I didn't mention those ones, but she also has hair loss on the head. But her cycles are regular, and they have become regular since she incorporated more resistance training. So she is managing some of the symptoms with diet and lifestyle. I think that's what's really important to recognize. We can treat insulin resistance with diet and lifestyle, and we can treat insulin resistance sometimes with pharmaceuticals. It just depends on the patient, where their levels are, how they respond, and their overall personal preference. Okay, so let's go back to the labs. I like to see an insulin around 20 to 40. If a patient came to me though, and they maintained their weight really easily, their hormones were great, they felt really good, their energy was great, and their insulin was a 60 or 80, and their blood sugar was fine, no problem. Again, pairing the patient history with the labs is really important. Cortisol, you can see here her cortisol level is 532 and the upper range is 535. So this is normal, but very, very close to the upper range. Cortisol usually peaks 30 minutes to 60 minutes after waking, and this blood work was actually done around 10 o'clock. So if she actually went to the lab even earlier, I would anticipate that it was higher. So there has been some things going on from a personal level. So we're really focusing on, okay, what can we do to manage this stress? Can we have a look at mindfulness? What do you do for fun? What is your purpose? What is your hobbies? What are your relationships like, etc.? Testosterone, the testosterone level, again, was high here, and the dihydrotestosterone was fine. So dihydrotestosterone is the super testosterone, but her testosterone levels are high too. And the one, I must have missed it when we went through here, but her DHEA, which is also another androgen similar to testosterone, it was 18. So she's got high levels of the androgens, the quote unquote male hormones, DHEA, testosterone. That's what's causing the part to get wider, the hair loss on the sides, the acne, the facial hair. So we want to talk about the different treatment options. There's natural anti-androgens, perhaps zinc, perhaps supplemento, spearmint tea. There are pharmaceuticals like spironolactone. There are a variety of different treatment options. It's best to get all of your available options. Ask what are the benefits, the risks, the alternatives. What if you do nothing, to all of the various treatment options that are out there. And when it comes to hair loss, I think it's much better to do this testing to understand, is a treatment often indicated? Because I will have patients come to me and we'll talk about their history, and they'll say, you know what, I tried spironolactone, or I tried this. I'm like, well, did you have labs done? Do we know? Was that indicated? Yes, you know, the hair loss pattern, you might have the pattern where your parts coming apart, you're having some hair loss here, you're having hair loss at the side. It might look like androgenic alopecia. It might look like too high of levels of these androgens, but the blood work will tell us if that is actually the case. The other thing we know is for some women, their testosterone's normal, but they're presenting like androgenic alopecia because they don't have enough progesterone. Progesterone at the level of the hair follicle will reduce 5-alpha reductase. 5-alpha reductase takes testosterone and converts it to super testosterone. So for some patients, it's not necessarily a testosterone piece. It's actually deficiency in progesterone that's making it look like a testosterone piece. And this is really important to recognize because it's not, or it shouldn't always be, triminoxidil, spironolactone. But then if you're on spironolactone, you need to be on birth control because you can't get pregnant on it, or at least prevent. It's just, we need to figure out what is going to work for each patient. Ideally, know that information, then we can guide the treatment plan. There's no one size fits all approach. And this patient, also remember, she has a combination of different hair loss issues. She has the higher androgens, but she also has the low iron. And we need to figure out, why is that low? What's going on with the gut health? We also need to have a look at, in patient cases like this, when the ferritin's lower, do you possibly have celiac disease? And we did run that for this patient as well, and she did not have celiac disease. If you have celiac, we see that associated with low iron, low vitamin D. Celiac is essentially an autoimmune condition where your body is reacting to gluten-based foods, breads, pastas, wheats, things like that. There could also be gluten sensitivity, there could be leaky gut, there could be bacterial overgrowth. We may need to have a look at what's going on in the digestive tract for this patient. In addition, the last thing I wanted to highlight again is the cortisol piece is higher. So cortisol, the stress hormone, that's going to cause or can cause diffuse hair loss as well. So a number of things that we need to work on, and we came up with a great treatment plan for her. We're going to be repeating the blood work in 3 months' time. If this was helpful for you, if this interested you, feel free to book a one-on-one consult with myself or somebody at my office. We have a variety of different practitioners that are licensed in a variety of different areas. If I can't help you based off of my scope of practice, we refer out. And if you are in the US, there is the comprehensive hair loss bundle where you can order your own blood work. In Canada, it's a little bit more challenging to access blood work. You do need a doctor's signature, and depending on where you're located, my office may be able to assist you. If you are in the US, it's very easy to purchase your own blood work cash pay. Usually you're looking at around $300 to $350 to do that. You simply pay the third-party lab company. Rupa Health is a really great resource, and then you get the requisition, you go to LabCorp. So I hope that was helpful for you. And if you have any additional questions or concerns, please let me know. And if you found this helpful, let me know as well. I'm going to continue to do more videos like this. Bye for now.